Well, hello and welcome to this final panel in the series from the UKRI-funded Public Voices in AI programme, hosted by the University of Sheffield in partnership with the Ada Lovelace Institute, the Alan Turing Institute, UCL and Elgon Research. And thank you so much for joining us today. I can see people still arriving, so I'll carry on with introductions. My name, when you can see me, is Octavia Field Reid. I'm an Associate Director of Public Participation and Research Practice at the Ada Lovelace Institute, and I'm delighted to be chairing what is an important conversation as governments and industry consider the development of AI governance in the absence of specific legislation. I'm joined today by panelists Professor Helen Margetts from the Oxford Internet Institute, Doreen Tembo from Health Data Research UK and PEDRI, and Professor Simeon Yates from the University of Liverpool, who all bring a range of different experiences and perspectives to these hugely important questions, and particularly about knowledge diversity, particularly knowledge about diversity and inequity in public attitudes and participatory evidence. So we're going to start by exploring current evidence about public attitudes to AI with a presentation of the results of the 2025 Ada Turing AI Attitude Survey by one of the co-authors, researcher Tvesha Sipi from the Turing Institute's online safety team. Then we'll bring forward the panel for an exploration of opportunities and limitations in current research methods that affect how equity and diversity can be represented in public attitudes evidence. So you folks in the audience, please do add questions to the Q&A because we're holding time for a really good discussion today. But just before we start, I wanted to give a few framing remarks that sort of explain our approach to this sort of research. So we've undertaken 2 waves now of the survey. It's called How Do People Feel About AI? And it asks a nationally representative public about their attitudes to multiple applications of AI, cutting across several domains in the private and public sector. And we're going to share a bit today about what we've learned along the way about public attitudes, but also about how to do this kind of research. So the 2025 survey was specifically designed to better understand how diverse publics think about different applications of AI and the potential impact of experiences of marginalization on attitudes to these technologies. And knowing that AI uses can have differential impacts across society and that AI tools can exacerbate gender, racial, and other biases that lead to discrimination and marginalization, we were particularly interested in evidencing the views of those that might be most affected by these technologies and making sure these views reach the people who make decisions about how AI is used in society. And then recognizing that much of the existing evidence on public attitudes to AI doesn't adequately represent marginalized groups, the survey deliberately oversampled 3 underrepresented demographics. So we oversampled people from low-income backgrounds, digitally excluded people, and people from minoritized ethnic groups such as Black British, Asian, and Asian British people. And we do this work because we believe that good quality evidence on public opinions is needed to make good decisions. And the use of AI tools in society is complex because new technologies and uses are constantly emerging. It's really hard to predict. And this means that decision makers in policy and industry have a really difficult task. There are competing incentives like growth and innovation, safety, fairness, not exacerbating its existing inequalities, and public voices are often missing or misrepresented in these conversations. But we also recognize that there are limitations to these kinds of studies, and decision makers trying to ensure that AI can have a positive effect on society for everyone need to know that they can trust evidence, and that's why we focused on these very robust and rigorous methods. So with that in mind, I'm going to hand it over to Tvesha to run through the evidence from the 2025 survey. Thanks, Tvesha.
Thanks so much, Octavia. Good afternoon, everyone. Thanks so much for joining us. As Octavia mentioned, on behalf of my co-author, Roshni, Helen, and Octavia, I'm going to be presenting key findings from our survey. This is the second iteration of it. And over the next 10 to 15 minutes, I'm going to cover some of the motivations underlying our survey, followed by methodological considerations, and finally, some key findings. Without further ado, I think everybody on this webinar is aware about rapid advancements that have taken place in AI, especially over the past few years. And while there are a lot of benefits to be reaped from this, especially in terms of speed and efficiency gains, there's still a lot of concerns around job losses and safety and security concerns. However, at the same time, we found that research about public attitudes towards AI is incomplete. And fundamentally, there are 2 specific drawbacks of existing research. The first one being that existing research tends to lump AI together into a monolithic entity and often overlooks the nuances of specific contexts in which different AI technologies are used. And the second one, like Octavia mentioned, is it doesn't tend to bring to focus marginalized voices in society. As we know, different publics in the UK would experience AI differentially, and therefore ensuring that everyone's voice is heard is important not only for responsible AI development, but its regulation as well, and finally, its adoption. With this in mind, we designed our study, and it distinguishes itself from the existing research on 3 key fronts. The first one is in terms of how we define AI. And we define AI very contextually, very specifically, which I'm going to come to in a few slides. We presented our respondents with 8 AI applications, and we asked them not only about how aware they were about these technologies, but also about their experiences with it. We also asked them about the levels of benefit and concerns that they perceived about these technologies, holding space for nuanced views about attitudes where people could both simultaneously perceive benefits and concerns. Besides just these, we also provide important insights for regulators and government. We ask people about their preferences for governance, what would make them feel more comfortable about automated AI decision-making systems, concerns around AI safety, data sharing, and decision-making in general. The third factor that distinguishes ourselves, and perhaps the most important one, is how we've sampled our survey. We use an up-to-date UK sample, which is nationally representative across key demographic features, but we also importantly boosted or oversampled minoritized groups, which I'm going to come to in a second. In terms of the methodology and how we were able to achieve this, we partnered with NatCen, and using their opinion panel, which was a random probability-based panel, which is kind of like the gold standard for survey-based research, it essentially means that everybody in the panel had an equal chance of being selected to our survey, and therefore there was no scope of selection bias. We were able to achieve a sample of 3,513 people in the UK that was representative across age, gender, and education levels. As I mentioned, we boosted on 3 groups. The first boost was for ethnicity, and we boosted for Black and Black British people, as well as Asian and Asian British people. And using this, we were able to get a representation of 12% and 6% of these groups in our sample respectively. We also boosted for low-income households, which we defined as those having an equivalized household monthly income of less than £1,500. And using this, we were able to achieve representation of 38% in our sample. Finally, we boosted for digitally excluded groups who may be on the fringe of actually reaping the benefits of AI because of low access to the internet or basic digital skills. We were able to achieve 962 participants, and which represent 27% of our entire sample. We used an online opinion panel, but we also used telephonic interviews to reach harder to reach populations. And while we were able to achieve this and hence get more diverse perspectives about AI, this also suffers from a few limitations. Importantly, we were not able to get to the desired target size for Black British populations. We could also not do any kind of intersectional analysis because of the sample size limitations. If you observe the ethnic groups, these are kind of broad in terms of Asian British, and Black British populations, and there are a lot of subgroups within these ethnicities who might have differential experiences with AI. But all of this is just a step in the right direction, and there's still a lot of scope for future research to be undertaken. In terms of what technologies we asked our participants, as I mentioned, we presented them with 8 applications which were clustered across 4 groups. The first one was to do with risk and eligibility assessments, where we focused on welfare benefits eligibility and assessing the risk of loan repayment or cancer detection. The second cluster was to do with facial recognition, and here we focused specifically on policing and surveillance. The third cluster was to do with LLMs and chatbots, and this was a new cluster compared to the previous survey that we'd undertaken, because when the previous survey was launched, these applications came into the public consciousness just a few weeks after, and so we couldn't cover this previously. And the last cluster is to do with robotics, which was driverless cars and robotic care assistants. The selection of these use cases was based on a triangulation of insights from our previous survey, cost and survey length limitations, as well as public conversations about emerging technologies. Having laid this context, I'm now going to jump into findings. And these are broadly categorized into 3 areas. First, in terms of awareness. The second is in terms of benefits and concerns. And the last element is in terms of insights for regulators and policymakers. Wherever possible, I'm going to try to interlace some of these findings with demographic differences in terms of inequities and how different public experience these AI technologies. In terms of awareness, as you can see from this chart, We've listed the different AI technologies and we asked people whether they'd heard of these technologies before. And we see that awareness of AI varies substantially depending upon the specific application we asked about. The top three most popular technologies were driverless cars, facial recognition for policing, large language models. Driverless cars was at around 93%, facial recognition was 90%, and LLMs was at 61%. Coincidentally, these are also technologies which are widely covered in the media. On the flip side, we see that assessing welfare eligibility is something that people are not aware about, and this is a bit disconcerting given how integrated AI is in public services and the impact that this technology has on the lives of people. Because we asked about two new technologies, which were large language models like ChatGPT, Claude, Gemini, we wanted to understand how people experience these technologies because they were relatively new. And we found that 40% of people had actually personally used these elements, and 67% of them were open to using them. Both of these are really positive aspects given how recent LLMs have been in public consciousness. The most popular uses for LLMs have been to use it as a search engine, to use it for writing emails and for educational purposes. But at the same time, people were not so open to using it for job applications in very specific contexts, such as legal disputes or taxation-related areas. When we asked them about mental health chatbots, we found that 7% of the public had actually used such a chatbot, which might seem like a small number in relative terms, but in absolute number, it represents 2 million people. This is an important point to note, especially given mental health chatbots is such a tricky issue with how complex human emotions and feelings are. It becomes important to note how AI models are responding to people in an ethical and responsible manner. We then move on to asking people about their overall perceptions of benefits and concerns about these technologies. We found that the public had high expectations about some technologies, particularly in health diagnostics and justice. For example, 91% people were positive about the use of facial recognition for policing, and 86% of people were positive about the use of AI for assessing the risk of cancer. Interestingly, despite being a new technology, 61% people were positive about the use of LLMs as well. On the flip side, when we look at concerns around AI, we find that the same technologies which people were relatively less positive on were also the same ones which they were most disconcerted with. For example, driverless cars was the least favorite option for people, and this is consistent even with our previous waves. As I mentioned before, 7% people had used mental health chatbots, and a lot of them were also concerned about mental health chatbots. We're also going to cover this more specifically in the next slide. And people are not only less aware about welfare benefits, but they're also more concerned about them as well. It's interesting to note the distinct demographic differences now, where we found that in terms of both benefits and concerns, we saw that those who had lower incomes and those who had fewer digital skills were less likely than the general public to view nearly all AI technologies as beneficial, and they were also more likely to view all AI technologies as concerning. When we looked at ethnic minority groups, it's interesting to note that the experiences of Black British people as well as Asian British people, we found that for facial recognition for policing, 57% of Black British people were more concerned compared to the general public, who were concerned only at around 39%. Similarly, Black British people were also concerned about welfare eligibility assessments at a far higher rate than the general public. This was 71% for Black people and 59% for the general public. I think it's important to note this fact that based on the people who might experience or who might be disproportionately affected by the specific AI context that we're talking about, their experiences and attitudes might also be different. When we place both benefits and concerns together, an interesting picture emerges. You'll see on this chart that there are blue bars as well as red bars. The blue bars basically mean that people's perceptions of benefits outweigh their concerns and are hence more positive. And the red bars basically mean that concerns outweigh benefits and are hence negative. We've also contrasted this across the both waves. And you will see that for 6 of the repeated use cases that we asked, in the previous wave, 5 of them were net positive, whereas in the current wave, only 4 of them are. While this may seem a little disconcerting, it's not really the case. That's not the complete picture to sort of focus on. It's important to note that people are positive and benefits have largely remained stable. However, the areas where people are more concerned about, like driverless cars or robotics, have always been use cases that people have always been a bit iffy or concerned about. Similarly, people are concerned about mental health chatbots for reasons that we've sort of discussed about how tricky these chatbots are and how sensitive these issues are. When we zoomed into the specific concerns and benefits that people had, we found that people were largely positive about the speed and efficiency gains from AI, as well as the possibility of reducing biases and mistakes that humans might have. But on the flip side, people were also concerned about the fact that a lot of decisions are going to be automated. And if these were solely made on the decision of technologies without any professional judgment, there could be mistakes and there could also be lack of transparency in decision making. The public were not only worried about these common concerns, but more specifically, 63% of the public were not comfortable with AI being used to make decisions that would affect their lives. This number also increases as we look at cross sections of specific demographic groups as well. And to counter this, people preferred to have some degree of explanation when decisions that would impact their lives were made. There was a strong preference, over 60% of people wanting to have explanations, and only 8% people felt that it's only the accuracy of the decision that matters. In short, people do want to have some degree of transparency around how these decisions have been made. Besides these decisions, people are also concerned about AI safety. 94% of the public were either very or somewhat concerned about the spread of AI-generated harms online, which were basically deep fakes, financial frauds, misinformation, and abusive content. And 2/3 of people actually reported encountering some of these harms a few times, which would basically mean them either personally experiencing them or witnessing this online. But this statistic is to be read with some degree of skepticism because it's still difficult to discern between what's AI generated and what's not, but it's still telling about people's concerns. And to solve this, an equal proportion of people, which is 58%, felt that both the private sector, as in terms of the companies developing these technologies, as well as independent regulators, should be held responsible for AI safety. We also found that overarchingly, 72% of people want laws and regulations. This is up 10% from the previous wave, where 62% people had an appetite for laws and regulations to make them feel more comfortable with AI. The second most popular mechanism was procedures or some sort of mechanism to appeal decisions being made by AI systems. And what this tells us is that there's some degree of hesitation around these decisions, and people want human intervention, regulators, companies, or appeal mechanisms to basically look at these decisions. In short, they want some socio-technical partnership that happens out here. I'm going to end with the fact that we found that over half of the public said that they feel that their voice is not heard and they don't feel represented in AI decisions, which takes us back to why we started this survey to begin with, as Octavia mentioned, in order to ensure that people truly feel heard, in order to ensure adoption and responsible development. It's important that diverse cross-sections of the public are heard in these decisions. Before I hand it back to Octavia, I'm just going to give a quick shout out to the authors, Roshni, Octavia, Helen, everybody on the Public Voices in AI team, and our funders for supporting this kind of research. And if you'd like to read more about our report, these are a few links, which we'll also paste in the chat pod. Thanks so much for listening.
Thank you so much, Tavesha. That's a very good run through what's an extremely complicated and deep piece of research. And I really would encourage people in the audience to dive into the report and to have a good look around there. Can I encourage the panelists to turn their cameras on, please, now? Tavesha, I think you might still be sharing your screen. But let's get going anyway. So just a reminder for you folks in the audience to start putting your questions for the panel into the Q&A. And I will be monitoring that, so I'll start asking them when they start appearing. But while you're thinking, I'll just kick off with a question for the whole panel to answer. And can I ask you please briefly just to introduce yourself and your work before you answer? We'll start with Helen, then we'll go to Doreen, and then we'll go to Simeon. So the question is, from your perspective, what are the most significant factors now in relation to public attitudes to uses of AI?
Hi, I'm Helen Margetts. I'm a professor at the Oxford Internet Institute at the University of Oxford. For the last few years, I've been the Director of Public Policy at the Alan Turing Institute, and I was one of the lead investigators on this survey. I mean, I think the first thing to say is it is really important to have evidence like this. I mean, Tuacia has said that in terms of people's voices being heard, but and I just wanted to reinforce that because in the end, AI is about people. It matters insofar as it harms people or it makes their lives better, and we know it can do both those things. But we know incredibly little about how people experience AI. We know there's a lot of buzz about it. We know that journalists are really interested. We know that researchers are really interested. And we know that politicians are really interested, but we just don't know that much about people. So I think evidence like this is really, really important. I just point to a couple of things. I mean, perhaps what I just said is particularly true of large language models, of applications like GPT and Claude and so on. Again, we know that journalists are just so interested in these, but what do people really think? And we might look at usage figures and all kinds of others data, but it's actually really difficult to know kind of in a overall sort of way what a population like the UK think about these technologies and how they're experiencing them. And what we're seeing by sort of, I could say design, but good luck, in fact. Our first survey at the beginning of 23 actually went in the field just before GPT was launched at the end of 22. So we do have here a kind of nothing to where we are now measurement of how many people are using these large language models and how many people are open to using them. So 40% of our sample had used them. I mean, that is a really dramatic kind of uptake of a brand new technology. And it's very important for AI because it's the first AI that people have been able to interact with directly instead of it being mediated by a large organization. And 67% said that they were open to using them, which I also think is a really remarkably high figure for a brand new technology, which, if you think about it, has been around for only just over 2 years. And I think the other really important thing is the question of the groups on which we oversampled, in this case, particularly low-income groups and people with low levels of digital connectivity. And for those groups, right across the board, across all the technologies, but I think it's particularly important with LLMs, those figures were lower. Less likely to be using them, less open to using them, less seeing the benefits of them. And that's important because it highlights that issue that's ever present when we talk about AI, which is one of equity. So I think that's really important as well. There's lots more findings in there, but I want to pass over to the other panelists. So I would encourage people to delve into the survey. Somebody's put the link in the chat, I think. So it's available for everyone to have a look at. So do that.
Brilliant. Thanks, Helen. And Doreen, we'll come to you next. You're muted, Doreen.
In terms of what concerns people the most about AI?
Would you just introduce yourself quickly first?
Sure. So my name is Doreen Tembo, and I head the public involvement and engagement team at Health Data Research UK. So that's the National Institute for Health Data Research. And as part of their portfolio, they also look at AI and applications of AI within big data. And I also head a partnership organization of about 18 partners, and that cuts across different data domains. So we do have AHRC UK looking at health, but we also have administrative data, and we also have financial data. So anything really that is patient-centered. And the reason for bringing those organizations together is because we all want to engage people and we want to do it well and to pull our resources and knowledge together. So that's Petri. And I have a long history of working with NIHR, so the National Institute of Health and Care Research. And with all of these roles, my main focus is to ensure that public voices and public members are involved throughout the whole research cycle. It's been a very interesting journey over the last 3 years, looking at how that can be done within data and AI, because it's a bit different to kind of the applied health context, where perhaps they are more easier to see ways of engaging with the public. So it's been intriguing reading the survey and the outputs, yeah, really looking forward to this panel discussion.
Brilliant. Well, we're delighted to have you here, Doreen. And could you tell us from your perspective what you think the most significant factors are in relation to public attitudes to uses of AI?
I think some of them have come out both in the talk, but also in Helen's comments. I think the key factors that we've seen is that people, especially when we're looking outside of health and looking at kind of economic data, is people are concerned about their role, their existence, and whether AI will take over. So really interesting that the survey, pinpointed the fact that people are aware of what's appeared in Hollywood and in media. And that's kind of the perception of will their role be overtaken by AI? And I think we've seen a lot of that, for example, in the creative industry and the concerns that are being raised around AI taking on some of the creative roles. And I have been focusing a lot on quality. So again, the survey has showed that people are concerned about when AI is making decisions about what affects them in very crucial ways, and health is definitely one of those. There is margins of comfort from people in terms of how comfortable they are for AI to take certain decisions. So for example, they are perhaps happy for AI to predict risk, but after a certain point, they'd like humans to be involved in the process. So I think a concern around the quality of data and the representativeness of data, because AI is only as good as the data that actually is powering it. So how accurate is that data, but also crucially, in the context of this survey, how representative is that data? Is the output actually only relevant to a minority population in terms of a minority of the population, or perhaps the majority of the population, but not taking into account the needs and the applications to the minoritized populations? And then I think another big concern that we see within health is the commercialization of data, and people's concern that their data has been used to make big money for big business and pharma. So I think that those 3 areas are probably the chief key concerns that people have.
That's really interesting to hear your perspective, and obviously that overlaps a lot with the findings of the survey that we've just presented. Simeon, coming to you, could you introduce yourself and then give us your thoughts on the question?
Hi, everybody. I'm Simeon Yates. I'm Professor of Digital Culture at the University of Liverpool, and I run our Digital Media and Society Institute. And one of my main research areas is understanding digital inequalities, not only just who is online and who isn't online, but their skills, their knowledge, and their kind of attitudes to a whole variety of digital technologies. And what we find, of course, is that, as this survey has found, that it's a very different set of experiences if you're somebody who's an IT professional, or you're somebody living on a low income in a more marginalized part of the UK. I mean that's obvious. We know that. It's the same. It's just as true for people's interaction with television as it is with digital technologies, as it is with AI. But I think there are quite a few important nuances that are in the report that show that people's perceptions of different types of AI are greater and lesser, and their understandings of those impacts are greater and lesser. As it said, you mustn't take it as a monolith. Now, we did a very similar survey, but looking at the workforce in the UK. So we looked at 5,000 members of the UK workforce, and we got sort of the same results. So that people from lower socioeconomic backgrounds, people with lower educational attainment, etc., were less likely to have encountered these technologies at work, and were less likely to be clear about what these technologies were and which types of ones existed. And were also much more likely to be very negative about how they might impact them at work. So why would your company bring this in? Oh, it's to get rid of jobs and save money. Whereas for those, say, in the IT professions, it was efficiency, effectiveness, innovation, came up much higher. So I think there's a very different lived experiences of engaging with AI, which this, the data from this survey points out. And I think that's the really important thing to understand, because we talk about hearing the public's voices. Well, the public is diverse and their set of experiences are diverse. And if we build policy on the back of, as somebody was saying, that Helen was saying the journalists like this, and what the journalists say about this, or what the IT companies say about this, or what the public sector in its attempts to kind of do the job better by bringing in technology thinks about this, what we'll end up doing is marginalizing more people, is putting them in more difficult circumstances because we've not really heard their voices. So I do think that's the power of this research. But I do think there are also some other worries in there. So, for example, the survey says quite a lot of people are open to using LLMs, right? Well, Google's got it up in front. You do a Google search and there's a bit of, I'm going to be derogatory here, with a bit of AI slop at the top there, right? And if anybody's done some Google searches recently, they can be quite misleading. It's not accurate. But we know from Ofcom media literacy data that people don't even really go beyond the advert bits in a Google search these days, and especially on a smartphone. So people are making poor judgments about where to go to find information already, on which we've now added another AI kind of layer. So I think that challenge of how you engage people with the importance of having the skills to work with AI in their everyday life, and in our workforce survey, how to engage with it in work, is a real challenge. But importantly, if you don't know their voices, you can't meet them where they are. And Octavia and I were talking about this earlier, that if you just have a deficit model that, you train people better, they will use it right. Well, we know that doesn't work for media literacy and digital inclusion and digital literacy stuff. You have to meet people where they are. So I think the really important thing around public attitudes is having an understanding of that complexity and that nuance. All the methodological challenges notwithstanding that we've sort of been hinted at and doing surveys across multiple factors and intersectionalities, but you can't make AI work for people if you don't know what people want from it or need from it. And I think that's really important. Then again, I would say that because our big project on digital inclusion is all about participatory methods and defining digital needs by talking to the public. But I think you see something very different. And on that score, the minimum digital living standards we've set, our first survey was pre-ChatGPT. Our update work we've just published is post-ChatGPT. And AI is now in the discussions there about, is it or is it not a necessary needed skill? At the moment, it's kind of on the borderline, so it's not in, but it's gone from absent to being there. And I think if we do it again in 2 years' time, there will be a need to have a basic, critical, and functional understanding of using AI as a digital skill that if a household doesn't have it, they're going to be at disadvantage. So I think it's going to get more and more important in people's lives.
That's really useful. Thank you. Can I move? I think you've all touched on, the reasons that we do this public attitudes research, and obviously, we want to do it in a way that represents, as many people in the population as possible. But we're doing it really to, provide better, fuller evidence to guide policy on data and AI, or to guide practices on data and AI. So if I could move you into thinking about that, and possibly Helen and Simeon, you might want to both come in on this. So where are the opportunities for that better, fuller evidence to guide policy? And also, just following on from what you've just said, Simeon, there are so many challenges of keeping up with the policy needs in this fast-moving environment. How do we anticipate? How do we make sure that we're in tune with the policy cycle and able to provide evidence at the right time?
Well, I mean, what I say to my PhD students is you have to triangulate. I mean, I think survey evidence like this is really important, but it can't tell the whole story. No piece of data can tell the whole story. We need transactional data to see how people are experiencing government on websites and search engines and so on. We need, I think, to do evaluations and trials. I have a project running in Oxford where we're looking at how people find out information from government and how they feed back information to government, and how whether they use AI to do that, and whether they what their experience is like when they do it. And then we need deep qualitative work, which is also being done of the kind that Simeon does and the Public Voices Project have been doing. We need to really get under some of the data. This data is a kind of pointer to all sorts of places. But for policymakers, I think there are some important messages here. Simeon has mentioned one of them. So, you know, if LLMs are going to be very widely used and are going to be such an important part of people's digital lives, then when people think about education in particular, rather than thinking, oh no, how are we going to have exams? We have to go back to handwritten exams because we can't cope with this. They need to be thinking more how they can tackle these questions of equity and the use of these technologies, and avoid the situation where really well connected people with high digital skills are getting much more out of the education system than people who can't access these technologies. I think another important lesson for policymakers here is perhaps some of the more negative findings about things like driverless cars. So the figures for driverless cars show that you know, the kind of media world have done their job well. They're excited about driverless cars. Almost everybody has heard about driverless cars, but that doesn't mean that they're excited about them. They're very worried about them. The figures for the net benefit figures are more negative for driverless cars by several degrees than any of the other technologies. And, you know, driverless cars are in action in San Francisco. They've come to Texas. They widely used in many localities in China. They do seem to be coming, and sort of legislation is on the way, and policymakers do talk about that. But there is a barrier to be overcome. I mean, there is, I shouldn't say a barrier to be overcome, but there's something to think about here in terms of why people are worried. And there is a worry too. I mean, many people are talking about a kind of robotics revolution. There's no doubt that there've been major breakthroughs in robotics. And in general, people are not keen on robotics more generally. I mean, robotic care assistants, for example, score pretty jolly lowly on this poll, although they are widely used in Japan, for example. And I think it's very important to drill down into why people are so worried about these things. I think part of the reason is that kind of human out of the loop. When you ask people questions explicitly about humans being out of the loop, they're worried. And there's kind of no more tangible sort of vision of that than a robotic care assistant or a driverless car where the human's sort of gone. So I do think that's going to be something for policymakers to think about going forward as legislation is prepared.
Thanks so much, Helen. Simeon, can I ask you the same question?
Yeah, so I mean, this is a complex sort of domain to think about regulation, because as we just said, AI is not one thing, and the public have got a whole variety of different opinions about the different types of AI, and they all carry different kinds of inherent risk. So I don't think there is one policy response. I think it needs to be appropriate policy responses and so on. I mean, one area we've already mentioned is skills. I mean, it's already the case that we are way behind our European colleagues, countries like Estonia, Finland, Sweden, thinking about digital literacy and media literacy type education, so that people come out of school capable of kind of sifting through the morass that, you know, the survey said people were worried about, which is the misinformation and disinformation and so on. So there's something really important there about thinking, as Helen said, about how we teach people to be critical, and both functional and critical users of this technology, so that they can keep themselves up to date, etc. Then I think there is an issue about thinking about how we regulate the use of different types of AI in different contexts. You know, healthcare has got an awful lot of regulation, but actually a lot of healthcare tech is less regulated than pharma, right? And then suddenly we get a whole new tech something coming in. So there's a question there immediately about how you twist or you fix the regulatory thing. The next one for me is also the government having a proactive role of being aware of what's happening with AI, you know, and trying to think about how it should respond. My colleague, who kind of looks at digital transformations and particularly around AI, Alan Brown, says one of the problems is everybody's got their eyes on the driverless cars, or they've got their eyes on the LLMs. Whereas what's actually happening is organizations are bringing in technology to do sift candidates for jobs. People are bringing in kind of technologies to do stuff with the finance. People are bringing in AI technologies to do other jobs, kind of back office jobs that aren't necessarily visible and aren't necessarily very kind of exciting, but have massive material consequences on whether you get a job, whether you get a loan, right? Whether you get put first for healthcare, etc. And in that case, there is a role for kind of government and other regulatory bodies to say, well, don't let this happen by default. Don't let people, you know, the boiled frog analogy suddenly, whatever. But I do worry that we're going to end up in a situation like we did with cars in the 1950s and 1960s. I don't know if anybody knows the book by Ralph Nader that kind of made his name, which is called Unsafe at Any Speed. So at that time, you know, to sell a car, it had to be amazing and big and do that and make, you know, look like a spaceship and drive really fast and have lots of features and so on. And he demonstrated that basically this was all killing people, that the cars were big and heavy and running children over, that anything, even like where the placement of the steering wheel and the manufacture of it was killing people in crashes. Petrol tanks were exploding, right? And he laid out all of the kind of problems with cars at the time. But it was the American car market did not want to be seen to be making boring, safe cars because people wouldn't buy them, right? Everything had to be exciting, right? And we're in a bit of that space with AI. The problem is that then people started to realize you have to regulate, but it took a lot of fighting and a lot of the kind of resistance you see now from the IT sector to being regulated, right?
Cars are such a good example, aren't they, for
Yeah.
where we are now? I mean, I
So
think
I think there's a role for
seatbelts didn't
government
come
of
into the
not getting
1990s, right?
caught out too late after the fact when we're actually trying to fix lots of problems caused by AI rather than having got ahead of the curve.
Yeah. Yeah, no, I really agree with that. Just to come back to the sort of experiences, Doreen, you've got lots of experience of attending to public views, particularly in the health sector. Can you tell us a little bit about what happens when we do get it right? And also, if you've got any examples of when we don't get it right, that would be really interesting to hear.
Well, I think it's always good to start with bad news, and you've got good news to look forward to. I was actually struck again by the survey and the findings around facial recognition for policing. I think one of the examples that's most well known is actually outside of health and more to do with immigration. So I think we're all aware about the passport picture kind of issue that blew up on the BBC, and the fact that the facial recognition there wasn't actually built to detect features in darker skin. So what was happening is that people from minoritized groups, predominantly with darker skin, then were being told, for example, that their mouth was open when they had bigger lips, for example, or that their picture wasn't of good quality because they had darker skin. And you can obviously see the effects that that would have then on kind of BAME communities of darker skin. So again, this was, you know, AI built on people of a certain skin type. So that raises a lot of resentment then for the AI. So it really showcases the importance of involving people in the design process, but also making sure that you're involving diverse people within that design process so that you don't effectively build AI systems that were in this case called racist by those communities. So I think that's probably, I think, an example that people are very aware of. So there's almost a flip, a different example I'd like to give, and this is more from my NIHR time. So this was actually by one of the slightly business-focused NIHR parts of the NIHR, and it's the NIHR Dementia TRC, and they developed an AI, and the AI is called CognoSpeak. And what that does is it aims to analyze language to actually determine your risk of developing dementia. So if it picks up that there are issues, it then basically escalates your case to the relevant humans per se. But of course, in looking at speech, there's different accents, there's different words that are being used, and there's a danger that AI might then be picking different minorities or people with different accents as perhaps having dementia or not having dementia. So what the group did is they involved different ethnic minorities. For example, they worked with Somali groups, and through one group, they then started working with different communities as well to ensure that the AI that was built was able to pick up that nuance, both in language, intonation, and so forth and so on. And they did some other things, such as building avatars that different communities would be happy to interact with as they worked with CognoSpeak. And what happened is that the research team built really great connections with the communities that were involved in that process. And they even won an international award in terms of the public and patient and community engagement and involvement that they did. So I think that really showcases almost a complete different example of what happened with the passport facial recognition, work, where in this case, they worked with different ethnic minorities and ensured that the output at the end didn't serve just one ethnicity or part of the population, but actually worked for a wide swathe of the population.
That's a really great example. And you've actually answered a question that's come through from one of our audience members, Mark Wong, who says, any insights about how minoritized ethnic people want to be involved in decision-making about AI or AI governance? And that's a really good example to bring forward of how you can do these things differently. We've got some questions, specific questions about the survey, Helen. I wonder if we could come to you just with a couple of observations. Somebody's asked, curious to know how these results could differ by age bracket. And is this something that we have insights on through the survey? But I wonder whether it's useful to think about any sort of differentials that really came through in the survey, and where we can say, absolutely specifically, this characteristic, this property is coming through as something that makes a difference to people's attitudes.
Sure. Well, yeah, I mean, I should say we haven't had the survey data so very long, so there's lots of analysis to do, and the data will be available. So, other people should think about doing it too. One of the things we found last time, which I think has followed through to this survey, is different attitudes to explainability and transparency. I mean, obviously, one of the big issues with these technologies is, nobody really knows how they work. And there are questions of when people feel that an explanation is needed, and when it isn't. And there's a definite age difference there, in that older people are more likely to prize explainability over accuracy, for example, whereas younger people are likely to be less worried about it, particularly perhaps reflecting the different contexts they've grown up in. But I mean, I think what needs to happen there is again, it's the kind of deep qualitative work that might be needed there. I mean, we did some work a few years ago with the Information Commissioner's Office on explainability and transparency, and that work was based on citizens' juries of people, asking them kind of where they want an explanation for something and where they don't want an explanation for something. And it's very, very context dependent. I mean, usually when you've got a serious health problem and you're given some kind of medication, you do want to know about side effects and things like that, but you're not always that worried about how it works. You just want it to work. And I think that's a sort of universal thing, that it's very context dependent. But there is an age phenomenon there as well. Another age difference is on robotic care assistants. Younger people are much more interested in robotic care assistants, or much more positive about them than older people are. And I would suspect that we can understand the reasons for that, that the nearer you get to thinking that you might need a robotic care assistant, then the more likely you are to think that there's a kind of, I think it comes back to this sort of human contact thing. I mean, I think if you talk to older people, that is the worry, that it will replace the kind of human contact thing of a real care assistant. And younger people are more likely to think about being care assistants and therefore perhaps being replaced. But those are just a couple of examples. The other one is the one that Doreen's already mentioned about the facial recognition technologies. I mean, I have to say one of the big surprises for us in this survey was that, you know, the kind of seeming popularity of facial recognition technologies in the figures, and I think somebody has observed that, and the sort of lower levels of concern among the population in general, but the much higher levels of concern among people from populations more likely to be discriminated against by these technologies. And that says something important about how we talk about these technologies, how we scrutinize them, how we deal with them in policy terms. You know, there's real concern there, and I suppose there's a kind of ruthlessly rational lack of concern among people who are not affected by it. But we have to somehow deal with that in policy terms and think about how to take these concerns seriously. Yeah, thank you.
Absolutely. And without getting too deep into the methods, I mean, we tried very hard to design the survey so that it was effective at answering some of those equity and inclusion questions that are quite difficult to answer. And we struggled with that, to be honest. I think that's fair, Helen, isn't it? You know, we wanted to go for a probability-based panel, which is, you know, the sort of methodological gold standard. We didn't want to opt for a convenient sample. You know, that's an easier way of producing a sample, but not so robust. And there weren't many organisations in the UK anyway that could actually provide the facilities to get to the survey that we wanted, and that could do the boosts of numbers in these underrepresented groups that we wanted. So there is a question about the actual capacity in the ecosystem to service these kind of things, and we're really interested in taking that forward and thinking more about the sort of how to do this well question to make sure that that information is provided for policymakers too. Helen, I don't know if you wanted to say anything more about that methods point.
Well, it's always been a problem for survey methodologies. The only thing I could say perhaps is that it's perhaps more of a acknowledged problem now. I mean, I used to work with surveys a very long time ago, and in those days it was just not kind of thought about. And a lot of the surveys you used to see in the 90s and 2000s were really looking at white Britain, basically. They just weren't acknowledging the fact that was the case. And they were using tiny sort of fractions of populations and kind of weighting the data up from those, which is methodologically a rather dangerous or not a satisfactory thing to do. We did try hard with this. Our Asian population, it was easier to find, but the Black population in the study was less than we wanted. And it was a challenge, but at least it was a challenge that was acknowledged. And I think, Octavia, you're absolutely right to say that we should sort of plug away at that and work out better ways of tackling it. I mean, sometimes it can be with qualitative research, but I think there is survey research here, survey evidence that we need for those populations that we need to be able to tackle. But as with many things, I mean, I guess the technologies, the very technologies that are used for doing surveys, not really AI in this case, but they do highlight the issue at least, and they do make people confront the issue head on. At least we know what a data is, if you see what I mean, which 20 years ago would not have been the case.
Yeah, cause for some optimism, though still some difficulties in the ecosystem. We're coming to the end, so I'm just going to bring in one more audience question, which I think you might all have something to say on. If I can ask you just to keep your answers to around about a minute so that we've got time to hear from all of you. But I guess this is a chance for you to kind of come forward with your opinion as well. So the question is from Mark Wong. The survey insights suggest people want government to have stronger regulations and protection of people from AI harms, but UK policy direction seems to be going in the opposite direction. What are the panel's thoughts on this, and any good international examples, especially in the global majority world, that the UK should learn from? Should we start with Doreen?
I'm not sure I want to start with this question. But to keep it very short, I think that that's a very, very insightful statement and question. We are going to see continued government support for AI. The government has an agenda around growth, and there is no getting away from the fact that, big data and AI are the future. I think, other panelists have mentioned how rather than scaling back, I think we want to make sure that people are not being left behind as kind of AI, progresses and kind of jumps with, and also, there's a certain graph that I saw that was really interesting that showcases how long it took each of the kind of social media AI type applications to reach a certain number of users, and the short time frame for ChatGPT is just astounding. So I think it really showcases that there's great appetite from the public and also from the government, and I don't think that will stop. There are obviously harms, especially as highlighted around teenagers and policy around kind of the digital context that the government is grappling with. But until issues, I think, as Simeon has mentioned, around regulation come into effect, I think the harms will be rising with the increase in the use of AI. So I think going back to the question around policy, I think policy in terms of really ramping up the information governance and also involving the public in information governance safeguards is actually really key for me.
Yeah. Simeon, can I come to you?
Yes, I mean, completely agree with that. I mean, I think we need more voices in the debate. I think there is clearly a challenge for most sort of governments in especially across the world. I was talking to people in Malawi about this. It's like every level of kind of economic development and circumstance. So it's facing the idea that AI is the answer. I think it's a challenge because there is a truth that there is so much money has been invested in AI. I mean, in terms of the capital investment that people have put and organizations and investors have put into AI, it's almost too big to fail now, right? And so you're asking, individual governments to fight back against that pressure, and they're also highly dependent on the IT providers who are all bringing also AI to their products to do the day job. Copilot is in Office. It's not sat in some fancy big system somewhere. It's sat on people's desks, the tool they use to write emails. So I think that's one of the issues around policy is that we need some transnational policy on this, which is even harder. But I think the EU, rightly or wrongly, not always getting it right, does seem to be a little bit ahead of Britain and others in kind of just saying, wait a minute, right? This is what citizens should have the right to have. Now, how do we sort that out? And I think we do need to think about that these are not solely national policy issues, transnational policy issues. And I used to always point to Estonia, because Estonia is a digital state and there's lots of great things that they've done, but they've kind of bought into the AI thing, right? Because the people who provide the technology for their digital state are selling it to them, and they've thought very hard about the use and regulation of these digital systems. So I think it's it is both a political and economic challenge for governments. Like I said, my worry is that we'll start legislating when the harms, as Doreen was just saying, ramp up, and the public demand for the harms being mitigated ramps up, which feels to me after the horse has bolted a bit. But that tends to be the history of the regulation of tech. But maybe we should be we're doing artificial intelligence. Maybe we should be a little bit more intelligent in how we plan for our regulation.
Very good answer. Helen, let me come to you for the last word.
Yeah, I mean, just on that point about regulation, I mean, obviously the UK has taken a particular approach, which is a sector-specific approach. We don't have an overall AI bill or act as has been created in the EU. There are advantages to that approach, and in the end, you probably need a sort of a mixture of the UK and the EU approach. But one thing I would like to say is that, you know, just as AI is complicated, regulation is very complicated. We actually have 108 regulators in this country. Well, actually, we don't really know how many regulators we've got, but it's about 108. And every single market, every area of society is being touched by AI. A lot of the AI harms that we worry about are actually kind of illegal already, or maybe they need adaptation and reformulation of existing regulations and laws. So every single regulator is needing to think about that. I was pleased to note that in the government's AI Opportunities Action Plan, it was mentioned that more resources were going to be given to regulators to sort of tackle this task. But there wasn't a pound sign. And I do think we need to keep an eye on that, on what sort of resources our regulators have to cope with these challenges, because as everybody said, it's going to be really important going forward.
That's a really helpful answer. And while we think very hard about the kind of evidence that we produce for policy and decision makers, obviously resources are a huge issue there as well. It just reminds me to thank the panel very much for their insights today. Thank you all for joining us as well. As Ruth has put into the chat, there is a huge amount of resources that came out of the Public Voices in AI project, and I'd really encourage you to follow the link and go and look at the other seminars that have happened in this series and the other resources that have been produced as well. But for now, thank you very much for joining us. Goodbye.